Delaware Governor Meyer tackles medical debt crisis. $50 million initiative explained. Breaking news. Delaware's bold $50 million medical debt relief plan launches. Could this change 17,000 lives? In a groundbreaking move that could restore financial dignity to thousands, Delaware Governor Matt Meyer has unveiled a powerful partnership that transforms $500,000 of state funding into up to $50 million of medical debt forgiveness. But here's where it gets interesting. This initiative comes alongside new laws that could fundamentally reshape how medical debt impacts Delawareans' futures. Newcastle. Governor Matt Meyer today revealed an innovative collaboration between Delaware and the nonprofit. Simultaneously, the governor signed crucial legislation designed to protect tenant records and remove medical debt from credit reporting systems, creating a more level economic playing field for state residents. When someone seeks necessary health care and ends up financially crippled as a result, we've failed as a society, Governor Meyer stated during the announcement. This debt relief program, along with our new protective legislation, represents our broader commitment to dismantling the structural obstacles that prevent hardworking people from achieving financial stability and building the healthy, secure lives they deserve. We're creating a Delaware where a medical crisis doesn't become a lifetime financial sentence. The mechanics of the program are refreshingly straightforward. Undue medical debt will purchase medical debt portfolios from healthcare providers and commercial debt buyers, then completely forgive that debt. Eligible residents won't need to navigate complex application processes. They'll simply receive notification letters informing them their medical debt has been eliminated. Allison, Sesso, CEO and president of Undue Medical Debt, praised the initiative. Governor Meyer and Delaware are demonstrating exceptional leadership by tackling the medical debt crisis at this critical juncture. With recent federal policy shifts threatening health care access for millions of Americans, partnerships like this become even more vital in providing relief to those most vulnerable. People who might otherwise avoid seeking necessary medical care due to financial fears. This program delivers both economic and psychological relief to families who never chose illness or medical emergencies, and we're eager to use this state funding to erase qualifying medical debts in the coming months. To qualify for this debt forgiveness, Delaware residents must either have a household income at or below 400% of the federal poverty level, approximately $100,000 annually for a family of three, or medical debt that equals 5% or more of their yearly household income. The debt relief will be announced in phases throughout the coming months. Lieutenant Governor Kyle Evans-Gay emphasized the state's commitment. In Delaware, we refuse to accept a reality where hardworking families are financially devastated by medical debt. Today's announcement demonstrates that commitment in action. Delaware's plan to eliminate $50 million in medical debt for just $500,000. Medical debt can often feel insurmountable, leaving individuals overwhelmed and financially strained. Yet here's where it gets interesting. A new initiative in Delaware aims to dramatically reduce this burden by essentially eliminating a significant portion of outstanding medical bills. And this isn't just talk. The state has a clear plan to make a real impact. Recently, Governor Matt Meyer hosted a discussion involving community leaders and advocates, addressing the escalating crisis of medical debt, bills that many patients simply can't afford to pay in full, sometimes accumulating to staggering amounts. The highlight of this initiative took place at the Hope Center near Newcastle, a building transformed from a former hotel into transitional housing, where Meyer articulated the partnership with a nonprofit called Undue Medical Debt. In this partnership, Delaware is allocating an initial budget sum of $500,000 to tackle an estimated $50 million in medical debt, affecting over 17,000 families in the state. Meyer emphasized the efficiency of this spending, pointing out that for every dollar invested, Delaware families are relieved of $1 of medical debt. This means the program is designed to have a tangible, immediate impact on those most in need. Undue Medical Debt CEO Allison Sesso added that most hospitals already have financial aid policies, yet many patients still fall through the cracks, either because they don't qualify for assistance or because the hospital's resources are limited. This program aims to address those gaps directly without requiring individuals to apply. Instead, those who qualify based on income being 400% below the federal poverty level or owing more than 5% of their income in medical bills will automatically receive a letter informing them of debt forgiveness. In addition to tackling medical debt, the governor signed into law two important bills during the event. The first, Senate Bill 156, sponsored by Senator Spiros Mantsavinos, bans the reporting of medical debt to credit agencies and prevents medical debt from negatively affecting a person's credit score. Advocates argue that because medical debt does not reliably reflect a person's creditworthiness, often resulting from unavoidable emergencies, its inclusion on credit reports is unfair and misleading. The second, Senate Bill 115, sponsored by Senator Elizabeth Tizzy Lockman and Representative Kendra Johnson, offers protections for tenants by shielding eviction records when certain conditions are met, adding another layer of safeguard for vulnerable populations. Want to stay in the loop with Delaware's latest news and initiatives? WDEL offers updates directly to your email and mobile device, making it easy to remain informed about ongoing efforts to improve community well-being. These legislative actions and the new debt relief program highlight a proactive approach to addressing financial hardships, but they also open up a wider debate. How effective can these measures truly be, and might there be unintended consequences? What's your take? Could such targeted programs become the blueprint for nationwide reform? Or are there limits to what legislation and charity can accomplish in solving deep-rooted healthcare financial issues? The conversation is just beginning. Feel free to share your thoughts below. Delaware eliminates $50 million in medical debt. What this means for residents. Medical emergencies can strike unexpectedly, plunging individuals and their families into overwhelming medical debt that weighs heavily on their financial and emotional well-being. But in Delaware, important progress is underway to protect residents from the harsh consequences of medical debt and offer them a fresh financial start. On July 29th, Governor Matt Meyer signed Senate Bill 156 into law, marking a significant step forward for consumers in the state. This new legislation bans medical debt from being reported to credit bureaus or appearing on anyone's consumer credit report. This means that medical bills, often unavoidable and beyond an individual's control, will no longer tarnish a person's credit history and limit their ability to access loans or housing. This bill, championed by Senator Spiros Mantsavinos, a Democrat from Ellesmere, aligns Delaware with at least 9 other states like New Jersey and Virginia that have enacted similar protections since 2023. Senator Mantsavinos explained the motivation behind the law, highlighting stories heard during a recent medical debt roundtable where real Delawareans shared how medical bills unfairly punish them. Because illness and accidents can happen to anyone, he stressed, one unexpected event can thrust families into financial hardship that erodes quality of life and stability. But here's where it gets even more proactive. On the very same day, Governor Meyer announced a partnership with the national nonprofit Undue Medical Debt to wipe out as much as $50 million in unpaid medical bills for over 17,800 Delaware residents. This initiative was made possible by a $500,000 investment through the state's fiscal year 2026 grants and aid budget, enabling Undue Medical Debt to buy and forgive balances owed by individuals earning less than 400% of the federal poverty level, or those facing medical debts exceeding 5% of their yearly income. Governor Meyer highlighted the financial impact of this effort, noting that for every dollar invested by the state, families save approximately $1 in medical debt. "We're lifting a heavy weight off the shoulders of many families," he said, removing the stress and anxiety that have held so many Delawareans back. In numerous ways, we are giving people a second chance when life throws them a curveball they neither expected nor deserved. This announcement and the signing of Senate Bill 156 happened shortly after a federal judge in Texas, appointed by former President Donald Trump, overturned a federal consumer protection rule that previously prevented medical debt from appearing on credit reports. This rollback makes Delaware's new protections and debt forgiveness programs even more critical. Kevin Myers, the governor's deputy policy director, was instrumental in forging the partnership with Undue Medical Debt. He began working on this initiative in January when Governor Meyer made it clear that eliminating medical debt was a priority. Both Myers and Allison Sesso, president and CEO of Undue Medical Debt, emphasized that the federal government's recent weakening of consumer protections makes state actions like Delaware's both urgent and essential. Sesso pointed out a harsh reality. Many medical debts exist because people simply cannot afford to pay them. There is an active market where nonprofits can purchase these debts at a fraction of the cost and then forgive them, providing real relief to those struggling. Beyond Delaware, Undue Medical Debt has erased over $22 billion in medical debt nationwide. The healthcare system often expects more than people can realistically pay, Sesso explained. Hospitals try to help with financial assistance and uncompensated care, but many individuals still fall through the cracks and end up with insurmountable medical bills they will never fully pay off. For Delaware residents who qualify for this medical debt forgiveness, the process will be automatic, no application required. Those eligible should expect to receive notification in the coming months, informing them of their newly erased balances. As for future legislation addressing the burdens of medical debt, Senator Mansavinos indicated that, for now, the focus remains on allowing these newly implemented programs to take effect before proposing additional measures when lawmakers return to Dover in January. And this is the part most people miss. While Delaware is taking bold steps to combat medical debt at the state level, the contrasting federal rollback raises serious questions about the future of consumer protections nationwide. Should more states follow Delaware's lead? Or is there a role for stronger federal safeguards? What balance should be struck between healthcare providers' financial realities and protecting consumers from debilitating debt? We'd love to hear your thoughts. Do you believe removing medical debt from credit reports and forgiving large amounts of unpaid bills is the right solution? Or could this approach have unintended consequences? Share your opinions. Let's discuss the best path forward for families facing medical debt.